Here we are, Dr. Peter's Fair One. We are packing our ER. It's all red. I would even say it's dark red. It's quite an alarming place right now. We'll see those numbers. You'll be scared.
Nurse Roland Santos, hello once again and welcome to So Jannelle. Thank you so much for joining us. I know you're very busy.
Thank you so much, Jannelle. I'm so glad I'm talking to you again after 4 months.
Exactly. They're saying that we're back from where we started. But first, I guess, definition of terms, we're hearing two words, spike and surge. And I'm making a point of this because I've spoken to some healthcare workers, doctors who are saying there is a spike, but there's no surge.
From the CDC standpoint, whenever you say it's a spike, really pertains to a single day increase of cases. So I would probably reference that by saying from yesterday, maybe I would have only 4,000, and all of a sudden I have 8,000. And probably a surge would be a greater amount of cases and maybe something more than a 1 day.
From those definitions, what are we having right now?
It's a surge, and it's quite a surge. And it's the way I say it is it's probably a crisis like no other. Really, it behooves us to really look at what should we have done differently in the past. Yesterday was actually the highest single day average just for Los Angeles County. We reached almost 8,000 cases yesterday, as compared to whenever we had that interview a few months ago, where it was only 3,000 cases. And all of a sudden now, our hospitalization rate in the LA County is over 2,000. Can you imagine? And most of those hospitalizations are ICU patients. You don't have enough ICU beds in the county. And so many hospitals are already looking at transferring their patients. But unfortunately, all the hospitals are currently saturated with patients. And I don't see any exceptions at this point.
That paints a picture, a grim picture of what's going on. And that's what we're getting in the news. But from your vantage point as well, what are you seeing?
Currently, on a day-to-day basis, including on the weekends, actually turning a report to the county about the number of cases for each hospital. And I see the number, the large amount of numbers and the testing, but it's not about the testing. It's really about how many of those are really testing positive. And our positivity rate has gone up too. It was running almost less than 3%, a little bit over 3%. And now we're up to 6, 7, 8%, which is quite a bit.
When did you start noticing the change again?
I think it's somewhere around the last holiday. It was Labor Day when it started picking up. People thought everything was fine, and they started congregating. They started having parties. Quite frankly, we have different directions depending on where your state is. And we have a lot of holidays coming up, and we caution people about the holidays. Look at the Thanksgiving holidays. We got the spike again right after the Thanksgiving.
With that said, how are you, our frontliners, bracing or coping?
Our frontliners have been in the field since, March. There's going to be a point where they're going to be tired. And so as a person in leadership, there really has to be some challenges, and definitely a lot of challenges about how can I make sure that my frontliners tired are not giving up on this coronavirus. So you have to be transparent to your team, saying this is what's happening, this is what we have, this is what we don't have, and you need to get expert advice from your CDC to make sure you're giving specific directions to your team, and so that your team is also well protected by giving them the appropriate protective equipment. And luckily, I think we were able to really get a bunch of personal protective equipment so that right now, I think it may be able to last up to 6 months. Hopefully by then, we should have some vaccine. So, I mean, there is a light at the end of the tunnel, in spite of the fact that this is something that we've never seen before.
From somebody like you working there in the hospitals nonstop and seeing the other frontliners working nonstop, selflessly sacrificing, what can we do? What are you asking of us?
Foremost would be spreading the cautionary message about this pandemic. It's not a joke, unfortunately. It is something very serious. It affects every single one. I think until it affects one of your family members, that's when you start saying, oh man, this is something really deadly, very serious. It's simple things. It's simple. Do not expose your high risk relatives. Protect yourself when you're going into the public areas by wearing the simple mask. And then, of course, the social distancing. That's still no gatherings of more than 3, 4 people. And of course, be educated. At this point, we need to spread the news out there. These are the things that needed to be done or needs to be done right now.
Once again, thank you so much, Roland, and to all of our medical frontliners, especially the Filipino frontliners. Saludo po kaming lahat sa inyo. Maraming salamat po sa inyong mga sakripisyo. And of course, I hope that we heed this call, this reminder to practice social distancing measures, to make sure that we're always washing our hands, staying away from big gatherings, especially indoors. Sana po matulungan natin ang ating mga medical frontliners. Their sacrifice, they are sacrificing. We should also be sacrificing to help and support them. It's not just for them. It's not just for us. It's for our community. Lalo na po ngayon, magpapasko na. Meanwhile, Toyotathon is on. Get incredible year-end savings like special leases and huge factory cashback offers on reliable new Toyota cars, trucks, or SUVs. Visit buyatoyota.com today for the season's best deals. We make it easy. They make it easy.